Well, what have we got here? Some very interesting data coming out, and it seems as though the numbers were oversold. Well, that's what the data seems to be showing us. So, for those who weren't aware, in 2022, 2023, 2024, in 2025, you kept on hearing about just how many lives had been saved by the rollout. People like me kept on asking, if that was the case, why is excess death still up? But it was inconvenient. You get censored for it. And you may not know this, but this channel is over 90% censored from where it used to be, say, 6 months to a year ago. So you can help by clicking like and subscribe because nobody gets to see this content because it is so important. So let's just look at something here. In 2022, this was the study that came out, Global Impact of the First Year of COVID Vaccination, a mathematical modeling study. Now, what you have to notice is that you always look at where they came from. These were from the Infectious Disease Analysis, Imperial College London. And as usual, you take a look at the funding. So Rhodes Trust, WHO, UK Medical Research Council, Gavi, Vaccine Alliance, Bill and Melinda Gates Foundation, National Institute for Health, everybody who had a vested interest in the best numbers ever. And you can see here, as I have highlighted, based on the period, now let's just get this clear. Based on the period between December 8th, 2020 and December 8th, 2021, 1 year, they believe that it prevented 14.4 million deaths from COVID 19 in 185 countries. Incredible. It was no wonder that they started to censor people who asked questions because they were saying the data tells you this was the most remarkable intervention. It was wonderful. Look how many people haven't died. Forget the fact that excess deaths are up. It's incredible. So, as what's happening is that we are gradually starting to see an evolution of the true science because it just didn't add up. At the time, I did a video. At that time, I probably almost 300,000 views. Was if this was the case, what happened to Africa? They didn't seem to be having a problem. So that's the reality. But here is what happened now. This is now another study. Global estimates of lives and life years saved by COVID vaccination, 2020 to 2024. Remember, the first one was 2020 to 2021, 14.4 million lives saved. From 2020 to 2024, therefore, let me just try and think of the numbers. We should be talking about 56,000 lives, a million lives saved. Let me look. Oh, look at this. More than 2.5 million deaths were averted. Hold on. In 1 year, you had 14.4 million deaths averted. And in 4 years, you have 2.5 million deaths averted. That's very strange, isn't it? So, as usual, you start off by looking at the funding source. And in this case, the funding support for the author here, the main author, was just a gift from Sue and Bob O'Donnell to Stanford University. This is where it was done. There was some funding from the European Network Staff Exchange, and that was about it. So he could therefore do a proper objective analysis of the data. And this is the reality. And let me just warn you, you're only starting to see the tips of the iceberg from the things that I've been talking about, because I am telling you, the reason why this is suppressed is because I really have a detailed understanding of the science. I've been talking with experts across the world for years. They identified and predicted these issues. And worryingly, this is only starting to identify some of the patterns that we had predicted. So, the first question that I ask myself is when I look at this study, even though it has dropped from 14.4 to 2.5, is this 2.5 actually accurate? Now, that's very worrying. It's like a negotiation where, you say, okay, I'll buy your car for 30,000, um, and then you drop it down to like 8,000. That's not good negotiation. So from 14.4 in 1 year to 2.5 in 4 years, those numbers don't sound as pretty. So when I looked at the paper, I had a few thoughts. And you have to understand first that this is a mathematical extrapolation as well, similar to the first study. Models may give unreliable results depending on assumptions. And one of the problems I've found is that many people who are doing the modeling don't understand what causes severe disease. Because if you understand the mechanism of severe disease, it would help you to be able to know when you're doing your models what are the right numbers when you look at something. So I'm just going to be showing you some numbers here that they've got. So from this recent study here, when they look at the lives saved by vaccination before Omicron, during Omicron, you know, for the age group 0 to 19, it was 299 young people that were saved across the world, 0.1%. Just look at that, 299. And can you believe that still in place in some universities, they still have COVID vaccine mandates? That is certainly not science. I don't know what it is. I'll not make any judgments. I'll try not to get into trouble, but that is not science. What they found was that exactly as we had said, because if you looked at the data, you knew who was high risk. So I wasn't one of those people who was against vaccination. I understood the autoimmune principles and I understood that there were risks, but I recognize that if you're going to take risks, do it on the cohort where the risk of severe disease is greatest, because if you're going to do something, at least minimize that risk. And so when you look at the characteristics in terms of the numbers, in terms of say 60 to 69, 519,836 compared to 299. Now, I mean, I can argue some more about some of these numbers, but the premise is that the risk was so clearly skewed to people who were older, people with comorbidities, exposed to the virus. And so another mistake that I will say now, just in case the WHO is coming to say, well, this is misinformation, I have always said this, and this data supports the fact that we knew the risk categorization of patients. You don't do the same intervention across the board, almost in nothing in medicine. Why would you do it in this case? And you have to remember that what happened in the pandemic, at the time, they didn't know that the vaccines were, not, well, you understand what I mean. And so, in effect, they left poor countries to have their vulnerable people die and force young people and children, in some cases, to get it in order to stop the pandemic, because they didn't understand that it didn't stop transmission of the virus. All of these mistakes need to be acknowledged. I know people want to move on from it and they don't want to acknowledge it. But the reality is this is what happened. Those were the mistakes. So, a few more thoughts that I got from this paper that I've highlighted. And it came a little bit lower down in terms of the discussion with regards to what was going on. The numbers that they have presented did not include the fact that there could have been adverse events that contributed to death. So when you think of numbers saved, you should balance that off with lives lost, because if somebody had, whether or not it was myocarditis or some VITT, vaccine induced thrombocytopenic inflammation or something, whatever was the contributing cause of death, you should want to balance that with what you think is the benefit. So let's be clear. The numbers that they are talking about, the 2.5 million, was about severe COVID-19. But there are some problems with that. As I've explained, if you understand the science, this virus was all about an overreaction of the immune system. That's the cytokine storm. And so, if you have a situation where the immune system has already been exposed to the spike protein, infection or vaccination, you are far less likely to have severe COVID 19. And so, what they were seeing when they presume this was life saving, it was that it was preventing severe disease. It does not mean that the person didn't die down the line. And that's a very important differentiation. Now, when we looked at the numbers, one of the points that I had said, if there had not been so much greed and politicians hadn't been so determined to take the credit for themselves, this is why they pushed mandates, because they thought that they would have a Churchill moment, that 100 years down the line, they would still be talking about these leaders who stopped the pandemic and saved so many lives. And this is why they pushed it. It wasn't really for anything else, in my view. They were after their moment in history. But they didn't get the science right because it didn't block transmission. So here is the problem. And I keep on coming back to this because it is the most important point that we have to try and understand. And it is the one that nobody really wants to talk about. I'll show you this here. This is about the storm. Because what I had pointed out is that if you immune prime the population and then they get infected and infected and infected, will you have worse mortality outcomes over the long run? And that's really the question at the moment. So that when we think about what should have been done, because this is what the data is showing us, with 0.01% risk in the under 19s, it's probably even lower than that, they should have been left alone. And truthfully, when you know people like Dr. Shetty, who knows how to save lives, who didn't have any deaths, you should have instituted an outpatient therapy protocol to reduce the risk of severe disease in that cohort, even if they got severe disease. Some people could. If somebody had already lung disease and they were a child, you may have then used an antiviral to support it. But you didn't need to broadly vaccinate that very low risk cohort. That's what I said from the start. Now, if there was a good understanding of that science, what they would have realized that if you allowed the population to get to herd immunity, and this is the thing, is people say, well, some people would have died. There is no way in a pandemic you don't get deaths. You're trying to mitigate them and you're looking long term. By trying to prevent all deaths, you actually cause more deaths. It's one of those strange situations where sometimes you have to accept a compromise. And the compromise was to allow the younger, healthier population to develop herd immunity. Some people will argue, yes, well, some people could have died because we didn't know. Yes, I understand that. But if you had combined it with early treatment, with people who were getting good outcomes, where even if they had severe disease, you got in early with your steroids, or if you used some other medication that I can't say to reduce the severity of the disease, you would have then been able to build herd immunity, stop the circulation of the virus, and therefore, what would have happened is that in your high risk cohort, who was then vaccinated, even if they were exposed, they would have had low risk of severe disease, and you wouldn't have the awful situation we've got now where the immune system across the population cannot control the variants because it seems to be too focused on the spike protein. And so everybody's getting infected over and over again. The outcomes are likely to be disastrous. That's where we are. And nobody wants to acknowledge that. One of the biggest pieces of damage that was done was highlighted in the paper here. And this is what they said. Even though COVID vaccines were clearly a major achievement, okay, their benefits did not necessarily match the benefits of several other widely used vaccines. That is blatantly obvious. Decrease in trust and increased hesitancy for these vaccines may be devastating. Listen, I keep on saying it, and people don't like it when I say it. When they start fussing about the unvaccinated with measles and whatever else. And I'm saying, hold on. You have just overhyped intervention for which the public looks at it and goes, hold on, you told us this and this is happening. That must be the same for all of them then. That's what happened. So the public no longer trusts anything they say. And they blame the public for that. Now, isn't that gaslighting? So this is where we are at the moment. The data, as I said, when you look carefully at this paper, they make a number of provisos here. They are only looking at modeling. They're estimating the amount of lives that were saved, and they specifically did not look at adverse events. And so your adverse events would dig into these numbers even more. So if you had 2.5 million people dying of adverse events within days or weeks or months, then the balance is zero. Potentially, if more died, the balance is negative. If this 2.5 is still too high, which I suspect it is, and there's a reason why I say that. One of the other important things that they don't seem to understand. There are some people who would not get severe disease because they had been exposed to other viruses, not just coronaviruses, rhinoviruses recently, and therefore had natural mucosal immunity. They're the people who just don't seem to get sick at all. That is a big cohort, and it could be, in some estimates, between 70 to 90% of the population. Additionally, even in your vulnerable population, the older people who had severe disease would only get it if they had a strong immune response. So if they had a weak interferon response because they're so frail or they've got other comorbidities and they just can't mount any good immune response, they would not have gotten severe disease. We saw this very clearly clinically, where patients who you think to yourself, goodness, this patient has definitely going to die if they get COVID. They get COVID and they have almost no symptoms. And it was just about how the immune system responds. So that's another cohort that wouldn't have had severe disease. Difficult to predict who they are. But the point is that when they look at these numbers, these mathematical models, they are unlikely to fit the real world. They think that one death was averted per 5,400 vaccine doses administered. So therefore, the question is, of those 5,400 vaccine doses administered, Did one person or two people die from adverse effects? If that was the case, the numbers would be negative. But we'll probably only hear about that in another few years because this is how it's coming out slowly, slowly, slowly. From 14.4 million over 1 year to 2.5 over 2 years. What will we hear in another 3 years' time? Let's see. Have a good evening.